the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. It is 6:24. An estimated 1 in 8 women will develop a thyroid disorder at some time in her life. So it's important to understand what the thyroid does in your body and what symptoms may develop when it doesn't function properly. Joining us this morning is family practice physician Dr. Laura Lester with Baptist Health Family Clinic in Malvern. Laura, good morning to you. Tell us exactly. You've got a pillow here.
This is a thyroid.
That is a thyroid. How does it work? Tell us
is
what it
a
does.
butterfly-shaped gland that sits in the bottom of your neck, and it controls a lot. It controls a lot of metabolism. It can affect your energy, your hair, your nails, your digestion, your skin, pretty much everything.
Wow.
I mean, it has a whole lot of important roles in your body.
So how do we know when there may be problems associated with our thyroid?
So the thyroid has, it can either be hyperthyroid, which means it's overactive,
Okay.
or hypothyroid, which means it's underactive. The most common is hypothyroid, where it's underactive. The best way to remember is, I brought a graphic. The hypothyroid, I think of being down. It's low, so you're cold, you're tired, you're weak. You have thin hair, you can have problems with constipation, you can have, all these, your body's just not moving fast enough. You just feel like you're sluggish. And then hyperthyroid is when it's overactive, and that's kind of the opposite. You're ramped up, you have fast heart rate, you sweat a lot, you have heat intolerance, diarrhea, you can have all kinds of things. I mean, there's the side effects from thyroid disease are just kind of endless.
Long list there. Okay, so what should you do if you think you have some sort of thyroid problem?
The most common symptom people have is just fatigue, just being tired. There's no reason for it. Nothing's happened, but you're just tired. You just feel like you can't get it together. And so tell your doctor, especially if you're a woman. It's very common in women. It's also very common in families. If you have a family history of thyroid problems, and you have some symptoms, you need to get your thyroid level screened.
What kind of testing?
It's a blood test. It tests for your thyroid. The thyroid produces thyroid hormones, and that's what goes to all the different tissues in your body. And so we check the blood and see what your thyroid hormone is doing.
So a very simple test. You could then get the help that you need and the treatment that you need.
Absolutely.
This is particularly important to you.
Yes, I did have fatigue, the most common symptom, and had abnormal thyroid test and was found to have hyperthyroid, and it's a lovely little picture. I had my thyroid removed because I was found to have thyroid cancer, a nodule on my thyroid. So they took it out in December, and which is when I got this thyroid pillow from a friend of mine. And then my scar's still healing, but I'm now on thyroid medicine, which is the same thing you would take if you have hypothyroid. Okay. The medicine that kind of acts like your thyroid hormone. So I'm on thyroid replacement and doing
So is that the typical treatment, to have it removed completely?
If you have hyperthyroid, if it's overactive, sometimes you need to have it removed. Sometimes you can do some other treatments or find another cause of what's going on. But the most common one is the hypo, and it's the same treatment as what I'm doing for the, you take the medicine, it's just a pill.
And you're feeling much better?
I'm feeling much better, yeah.
Fantastic. Yeah. Great to hear that. Good information as always. Dr. Laura Lester, thanks so much for being here. If you have a question, you can always call the Baptist Health Helpline at 1-888-BAPTIST.